So, today I'm going to present a case called edema, a rare complication of plasma donation in an adolescent female. The authors of this case are Elahe, Shychuk, Krystal, Glasford, Andrew Shychuk, and Nancy Joseph. We're going to be looking at the matter, history of present illness, review of systems, past medical history, personal and social history, family history, physical exam, and finally assessment and plan. So let's get right into it. The matter at hand. We have a female adolescent patient with discomfort and tightness on ankles for the past week, which is basically the same as the history of present illness, is a female adolescent with 1 week history of discomfort and tightness associated with ankle edema. During the review of system, the symptoms were in the cardiovascular system was that there was no palpitations, no tightness, no dyspnea, no pain. There was also no dizziness present, no changes in urine output, no pain, no abdominal pain, no diarrhea, no constipation, no vomiting, and no nausea. The past medical history was relevant for an intervention that she had done. So she donated plasma 2 weeks prior to the presentation of symptoms, and she did that twice a week due to monetary incentives. She was also been in the contraceptive pill for several years, and she has a past medical history of acne, which is why she uses medication as topical tretinoin and clindamycin. In a personal social history, what's relevant is that she didn't smoke, she didn't drink, and her family history, her maternal grandmother had hypertension. During physical examination, she was described as afebrile, which means that she didn't have a fever. So she probably was around 36 to 37 degrees Celsius. Her blood pressure was 112/60. Her rate was 82 beats per minute, and her oxygenation was at 98. During the examination, there was a noticeable bilateral peeling ankle edema, and it was localized. There was no tenderness and no overlying erythema or discoloration, and her sensitivity was intact as well. So the only relevance in the examination of the systems was that there was no malnutrition present, and urinalysis test was done, and it came back negative for ketones, glucose, nitrate, and leukocyte esterase. So the initial treatment was to discontinue plasma donation, to elevate the leg, to have a well-balanced diet as well as protein intake, and to use compression socks. During the physical examination of the 4-day follow-up, the bilateral pitting edema had extended to the shins, ankles, and feet. There was no tenderness to palpation near deep veins and no additional symptoms like dyspnea, cough, dizziness, palpation, weight changes, etc. Because of this extension, other tests were done. Pregnancy test came back negative. The urinalysis remained the same as before with negative ketones, glucose, nitrate, and leukocyte esterase. The complete metabolic panel was low total protein of 5.5 grams per deciliter and a slightly low albumin of 3.5 grams per deciliter. The complete blood count of hemoglobin was around 12.1 grams per deciliter, and there was a Wells score of 0, which arose suspicion for deep vein thrombosis. An electrocardiogram was ordered, but it was not obtained. So heart failure was discarded because the patient was young and there was no history of congenital heart disease. Infection was also discarded because there were no active signs of inflammation or cellulitis. And deep vein thrombosis was suspected due to contraceptive pill use, but because there were no risk factors like smoking, trauma, malignancy, or tenderness, it was discarded as well. And celiac disease, well, overall, there were no gastrointestinal symptoms, so it was discarded. And hepatobiliary disease was discarded as well because the edema was limited to lower extremities, and there was no stigmata of liver disease. So the diagnosis overall was the acute decrease in oncotic pressure due to the plasma donation because there was a loss of albumin. And a loss of albumin means that there's a decrease in oncotic pressure. And this was also this diagnosis was reached because the onset was acute and because the edema was isolated to the lower extremities. So the plan was a conservative management of avoiding plasma donation, the elevation of legs, proper hydration, and a well-balanced diet. The outcome the symptoms were resolved at a 2-week follow-up, and she remained asymptomatic during 2 years because she stopped donating plasma, and that's why there was no edema recurrence. Thank you so much. That was it. These are my resources.